Good afternoon, my radio listening audience. Welcome back to part two of Matters of the Heart radio broadcast today with your host, radio host personality Princess Denise, and my special guest that's in the studio with me today, Ramona Valentine. Before we get started, I want you to go ahead, if you have pen and paper, if you go ahead and just write down this number to the studio in case you do not know what it is. And that number is 727-637-2416. If you'd like to call in and have a question or comment today for the presentation that my guests will be giving in a few minutes. Now, if you were on part one, heard us, great. But just stay tuned and listen to the details and the pertinent information that she'll be sharing about health insurance and what you need to do, how you need to do it, and so that you will have insurance to cover you when you go to your doctor visits or go to the hospital or whatever else is going on. So at this time, again, the number is 727-637-2416. All right, Ramona, will you continue?
Sure, Miss Princess Denise.
Yes.
Okay, so we were talking about part A, B, C, and D. So I'm going to continue on how to get more coverage if you're still working. Now you have to wait until, for the people who are 63, 64, 65, have to wait, and 66 have to wait till they're 66 and 8 months to retire and get their Social Security. So a lot of those people who are Medicare eligible are still working, and they may be using their employer's insurance. So if you're interested in going off the employer's insurance, or if you're going to retire, you have 2 months after your job-based insurance ends to join a Medicare Advantage plan, and that's the Part C plan. Also, you have 2 months after your job-based insurance ends to join a Medicare drug plan, and you have 6 months after you first get both Part A and B, if you're 65 or older, or to buy a Medigap policy. Okay, so those are the three types. Most people who have original Medicare and a Medigap policy will also purchase that Medicare drug plan as well. Okay, but if you want to avoid the costliness, go with a Medicare Advantage plan. That's going to be the most economical way to go. And many of the insurance carriers are paying a portion of that Part B for you. If you're not eligible for Medicaid, you can go with the insurance company that pays for part of your Part B for you, and they all have co-payments. Some are zero, some are low, some are higher than others. So if you are interested in any help, I'll leave my number at the end. We can only talk about educational things today, but if you are interested in learning more about what would be more beneficial for you, you can give me a call after the show at 727-241-9230. And Princess Denise, can we allow our audience to call in for questions?
Oh, yes. Again, I like to make it known, all of you that are out there listening in Radio Land, feel free to call in during the next 15 minutes of this program. So, again, as I stated, the number is 727-637-2416. If you have any questions, comments, need some more information, did not understand something, and whatever, may be on your mind. I also know that my technology individual is here, Mr. Al Christopher. Al, do you have any questions or comments you want to make regarding anything you need to know? No? Good. Okay. All righty. Just wanted to check with you. Everything is okay? Everybody okay? All right.
So
Okay.
I have a question.
Go ahead, Donald.
So I think I am 64. I
Oh,
forgot
did
my
somebody lose your paperwork? Donald, you too funny.
age. But so the Medicare Advantage, you're saying that I have to first get into retirement 2 months after my retirement before I can get into the Medicare program, the Medicare Advantage program.
No, no. The first thing you want to do when you about the time that you turn 65, like 3 months before you turn 65, the month of your birthday and 3 months after is when you should apply for Medicare's Part A and B.
Oh.
Okay? Just make sure you have that first. Okay. Now, the Medicare Advantage plans require that you have Part A and B. So you have to start, the first step is to get Part A and B when 3 months before you turn 65. Now, some people automatically get their cards. Princess, you know, and
did.
Donna.
I did.
Did you? Okay. Some people do, some people don't. If you don't see your card coming within a month of your birthday, go talk to Social Security.
Because I see them sending me, documents in the mail, documentation. I just put them aside. I say, I'm not ready for this yet. I'm not.
Oh,
Okay.
yeah.
Well,
Donald.
Donald, when do you turn 65?
Next year.
Okay, so
Okay.
you have a whole year
A whole
away.
year.
Okay, so you've got a ways to go. Okay, so what's your birthday?
March.
March.
March,
Okay.
okay.
So
That's good. That's
yeah,
coming up soon, Donald. That's great.
you're talking about March of 2023 is when you turn 65. Okay, so you should be seeing something coming from them by January.
Okay.
December, late December, January, and if you don't see it in January, call them.
Okay.
Call them or either go to the Social Security office and take your documentation, driver's license, a Social Security card with you.
All right.
And just make sure that you're going to get that Part A and B.
Okay.
Then if you're interested in a Medicare Advantage plan, which is the most economical way to go. That's what I'm going to do. I'll turn 65 in 10 months myself. So at that point, you'll be able to apply for your Medicare Advantage plan. But you have to have that A and B first.
Yes.
Exactly.
And
Exactly.
the Advantage plan, you can get in one that will cover your A, B, and D for you, and then give you that vision, dental benefits, and your hearing benefits, and give you your gym membership.
Okay.
Okay, no cost to you.
Okay.
And so you get so many extra benefits, and you get over-the-counter items that that's no cost to you as well.
Sounds good.
Yeah,
All right.
it's great.
That's great. I'm glad to hear that. Oh, yes, absolutely. Well, Ramona, it's good listening to that because I think, let me see, is that 2019? I think it was 2019 when I turned 65. And I was glad that one of my friends had called me one day and she was telling me about this Medicare, Medicare rep or something like that. They come out to your house to talk about Medicare and all that. And because one of my friends kept telling me something about, you had to have a supplement plan. That you had to have a supplement plan. And I was like, well, every time I call them, they're not mentioning nothing about that. And then I called them Medicare, and they kept saying everything is already in place. You don't have to do anything. Everything is already in place. So I was like, oh, okay. He just told me all about what you need to do, getting supplement and everything like that. So he set up everything and got it all set up for me good. And he says, I'm going to do this, connect with Medicaid. I'm going to do this. Something he was doing for his mom and saying, I'm just going to just do all this. And so we got it all done together. So it put me in a place where I didn't have to pay anything, anything at all. And
Okay. Well, I'm glad that's working
I
out
hope
for you.
Yeah, I hope it's continues like that.
But supplements, normally people pay for them themselves. Medicaid will pick up the costs for those. But if you have a straight supplement, that is just covering the 20% that original Medicare does not cover, and it doesn't give you any extra benefits. Now, for people who are eligible, chronic special needs plans are what I recommend. Those are for people who do not have Medicaid help, and if you have certain conditions, cardiovascular disease, diabetes, congestive heart failure, COPD, or you don't have to have emphysema, but emphysema is one of those in the COPD, chronic bronchitis, or asthma. Then there's a specific Medicare Advantage plan called a chronic special needs plan, and it has extremely low copays. It has grocery card added to it. It also has all the other benefits, the hearing, the dental, vision, and a lot of things. So even if you have not been diagnosed with one of those conditions, there are certain medications. Some doctors will do a verification form for you so that you can go on one of those plans. And I particularly like those plans and recommend those to people who don't have Medicaid.
I'm just going to say, thank God none of them are in existence. Thank you.
Now, if you do have Medicaid, there are Advantage plans that will give you everything at zero copay, and also you get a grocery card. I've seen the grocery cards in the $200s of dollars per month. I've seen also they'll give you a very generous over-the-counter benefit where you can get your over-the-counter stuff like your vitamins.
Oh, that's what I do, yeah.
There are other companies out there that give a generous benefit plus your medications and all that other stuff as well. So, yes. So,
Alrighty.
I would like to say for those who are interested in the chronic special needs plan who don't have Medicaid, you can always give me a call and I can help you with that after the show later on. But if you have any further questions about Medicare, give me a call and I'll be happy to help you with it.
All right.
There's something called Medicare Advantage Dual Special Needs Plan. And if, Denise, if you are getting a grocery card or anything like that, you're actually not on a supplement. You're on an Advantage plan, just to let you know, because supplements don't give you grocery cards.
Yes.
So that a supplement is something that only takes care of 20% of Medicare. It doesn't give you anything else. Just to let you know. Okay.
Thank you,
right.
Ramona, for that.
Sure.
Because, like I said, a lot of it I don't understand what all he did, but I just know it's good that when you finally got to that age, the things were working out the way they put them at there for you to have what they wanted you to have. And so I just hope everyone else that's listening today will give Ramona a call.
Okay.
And I would like to. I'm listening, and things are running through my mind because we have a lot of folks, my age and up, that how do they get this information unless somebody shares it with them? For instance, had I not heard it from you today, I would know. So the normal person at home that goes nowhere because they are in age up there, how do they know this information? Is there some place that this information is shared?
Sure. They can go to Medicare.gov, or they can ask someone like me who was a benefits consultant and insurance agent. So they can also call me, and I can give them.
My point is proactively. Unless somebody because unless you know to ask about it, you still don't know.
That's right,
So
Donald.
how this is not in your mind, this is not in your head. So do we have people in the community, in any system of government, that take it as their responsibility to educate the elderly folks how they know these things? Because I'm pretty sure then that this benefit is there, and they're not taking advantage of it if they don't know about it.
Well, people like me try to educate the public. We have seminars. There are some organizations that have seminars. Basically, what I'm going over is called Medicare 101. It is part of an educational seminar.
Okay.
And I'll be doing one on December 8th at Carrabba's Italian Grill. Anybody that's interested in going to that, they can give me a call, and I'll let them know what time and everything that they can go to that. So it'll be a Medicare 101 seminar.
Okay, good. I think this is good information.
There he is. Yeah. Donald, you're absolutely right. Some people, like you say, no, we know knowledge is power, but a lot of times people don't ask for that kind of information until the last moment. They're just thinking, I'm going to be getting Medicare, that's it. And they're not thinking about all these other things that they don't even realize that unless they ask about this 20%, that they'll be responsible for. Because I know years before I retired myself, I was going to seminars like that. When you work for Allstate, you go to a lot of stuff. So they were always talking about these different things, so you would know in advance. But I'm just like Ramona. She's a consultant about that, and I'm so glad that I got one to come out before I turned 65, only a few months before. So he gave me all the information, and he really went as far as he could to make sure you're in tight with things that you would need that would truly help you, and told you what the cost was, and I'm gonna see if I can do this for you and do that, and see what the benefits would be on your behalf. So it is, and so a lot of people don't think about things to the very last moment, and then they find out, oh, I gotta pay this. What? What? I thought they supposed to pay everything.
You're right. It is very expensive if you just stick with original Medicare, because only 20% of whatever the bill is what you're going to pay.
Exactly.
So it's best to, not everybody qualifies for Medicaid to help them with any extra costs. But, and if you don't, in my opinion, the Advantage plan is just the way to go, because you're going to get everything all rolled into one. And most do not have a premium. Most do not have a deductible. So you go right in using the insurance.
Okay.
So that's the way to go. And I don't have anything else to say about Medicare.
Well, I want to thank you for making that clear about the Advantage plan, not supplement, because you cleared that up, and I'm glad you did, because that's what it would have been. Because when people come out and explain all that stuff, I just had the wrong word, but it is, because that's the way it's working right now. So thank you, Ramona, for coming today. Anyone
Of
else?
course.
Anyone else that would like to call in? We're getting ready to go off the air. But if you have a question, we can maybe take you for another couple of minutes. The number again, 727-637-2416. If you have a question or a comment, well, that would be nice. But anyway, all right, Al, you say you have nothing? You'll call Ramona, right? Okay, thank you. My technology guy. So that's right. Well, I want to thank everyone today for listening to the broadcast, because, like I say, knowledge is power. And I thank Ramona Valentine today for setting aside this time to call in. And I think we got a caller. Someone call it in. Let's make sure, see if it's a question.
Let me stand by. I'm ready to talk directly to her.
All right.
We got a call.
Got a call on there? Okay. Caller, you on the air?
Good afternoon. This is excellent information that I didn't even know I needed it. I heard it.
Okay, good.
What is Ramona's phone number?
All righty, Ramona, will
It's-
you give a call?
Yes,
your
of
number?
course. It's 727-241-9230.
And she's Danny Drake.
7241-9230. I appreciate you guys.
Okay,
Thank
you're
you.
welcome.
Bye-bye.
Bye.
All right, thank you. That was good. I hope she got it down exactly what she
She
said.
put it in her phone right away.
I see. You heard it too,
That's
Donna.
great.
Yeah, she did. She did. She put it right there. So
I'll be happy to help anyone who needs help deciding what to do or moving forward. I also can help people if they're needing to get Medicare, if they're needing to apply for Part B or Part A and they haven't done so. And also I can help them with a Medicaid application too as well.
okay.
Yes.
That's good.
So anybody that is interested in that, just give me a call.
All righty. Radio listening audience, I hope you heard that. Ramona Valentine will be glad to help you in any way with Medicare and all of your concerns about your health and whatever else that she's able to provide for you at this time. And even if you're already 65 or over, she'll be glad to assist you. So thank you, everyone, for listening to the broadcast today. We thank you for tuning in. And most of all, I thank my guest, Ramona, for coming in today to share all this vital, important, significant, powerful information that we need to know regarding our health and having health insurance and being able to get certain things done. And for God's sake, not having to pay an arm and a leg for all medicines and everything. So with that being said, you have a great weekend. We thank you. Hope you'll go to church tomorrow, or at least get on a conference line and hear a word of God. And God bless each and every one of you until the next time we come back on. This is Princess Denise Wright signing off. And if you have any questions about wanting to be one of my guests on the radio broadcast, give me a call at 727-488-8818. God bless you. Have a great day. Amen.